Hi, my name is Morgan Cups, and this is the part 2 assessment. So here's the 360 of the room. And then here is my video confirmation form, and then this is Grace Thuman, and do you consent to the video?
I consent.
All right, and then this is my ID badge. Okay, so to start, I would come in and I would wash my hands, introduce myself to the patient, ask for 2 patient identifiers such as name and date of birth. I'd apply gloves if necessary. And then I would ask, do you have any previous conditions such as arthritis?
No.
Or congestive heart failure?
No.
So I gathered the past medical history, and so now I'm going to assess the 5 heart sounds. Okay. The first one is the second intercostal, and it's the aortic. The next one is the second intercostal on the left side, and it is the mitral. The next one is the third intercostal down, and it's Erb's point. The next one is the fourth intercostal down, and it is the tricuspid. And then the last one is going to be the fifth intercostal down. And it is the mitral. All right, now I'm going to pick a location to listen for 30 seconds to get her heart rate. And I'm using the clock on the wall. There were 36 beats in the 30 seconds, which means that there was 72 beats per minute, which is normal and within range. All of her heart sounds sounded normal. There was only S1 and S2. There were no extra sounds that happened. Now I'm going to assess your arms, so can I put your arms out for me? So I'm looking for any redness or inflammation and looking at the condition of the skin. And there appears to be no redness or inflammation. There are just a few freckles on the left side and a few on the right side. Now I'm gonna have you squeeze my fingers. The strength is equal bilaterally for the two, and the arms are symmetrical. Now I'm going to assess your legs, so can I put your legs out for me? So I'm gonna start by looking at the color distribution and the condition of the skin. So the color is a light tan, and the skin is in good condition and intact. There's very little variation. Next, I'm looking at the hair distribution, and she does shave, but you can still see the hair follicles, and they are evenly distributed across the legs. The skin is intact, and there are no lesions present, and then there are no venous patterning that you can see on the legs, which is good. Next, I'm going to assess for moisture and edema in her legs. So I'm just gonna pat the backs of my hands down your legs. There is no moisture, and I'm just going to assess for edema. There's no edema in either leg, and now I'm going to look at any sort of variations on her legs, like primary, secondary lesions. There are a few primary lesions, which are freckles that are spread out throughout the leg, scattered. All of them are about the size of the top of a pin, and they are all brown, and they're all circular. There's no abnormalities. There does not appear to be any secondary lesions or anything of those natures. There's no scarring. Next, I'm going to assess her pulses. So I'm going to assess the tibial pulse first. And it's a grade 2. And then I'm going to assess the dorsal. And it is also grade 2. Do you have any numbness or tingling in your legs?
No.
And then I'm going to check for any ulcers. And there are none. So that concludes the assessment, and I would do my closing and document all my findings. I would make sure that both bed rails were up, the patient had their call light, and then I would exit the room. Thank you.